Hey guys, welcome to another episode of Ty and Sky's Health Pub. This is Sky here, and we got Ty, and we're here today with Molly. She is the Immunization Program Manager here at the North Dakota Department of Health, and she's here today to talk to us a little bit, to have a nice discussion on HPV. Yes. So first of all, I guess just to kind of give a little bit of background, first, it's an acronym. So what does HPV actually stand for? Because I don't know what it means.
And you're the acronym genius.
HPV stands for human papillomavirus, which is a family of over 100 viruses that cause everything from warts on your hands and your feet to cancers.
Oh wow! So it's something that like. Do all warts equate to this then? Should I be concerned if I have a wart or something? Because I'm already like kind of scared. I'm like, not that I have a wart or anything, but it's like I know people that have warts. So is it likely that they have HPV?
Yes, actually, but there's different strains, so they're not all the same type of HPV. But yes, most warts, the vast majority, are caused by HPV. Yes.
And I guess kind of a follow-up question that comes to mind, maybe an alarming follow-up question. So obviously in the past when I was a child, I remember having warts kind of on my feet, and you mentioned some people have them on their hands. Mm-hmm. So an obvious question that follows that, if I have warts on my hands or my feet and touch my genitals, do the warts transfer to my genitals?
It's possible, but it's not the same type of HPV infection as you would think of with genital warts.
Okay, so we're thinking something different along those lines.
Yes.
Okay.
Different strain.
Wait, yes. So it's like the same thing but different? So it's got like a... like, because what I'm trying to understand here is like... Because now it's just kind of eye-opening to be like, all right, so we kind of have an idea what this is, all right, and it causes cancer. Mm-hmm. So there's multiple... So like most people with warts are going to have cancer? Is that what you're saying then?
I am not saying that.
Okay.
No.
Okay.
There's over 100 different types of HPV strains, and certain types can cause just the warts, everyday warts you get on your hands or your feet. And then there's more high-risk types, which can cause the cancers or can cause genital warts.
Okay.
And not everybody who gets HPV will go on to develop cancer.
Okay, so it's kind of like how like it's on a grading scale where like if I have like advanced like is it kind of like a because maybe if I'm walking out like in the middle or like like and I step on something like is that how I can get this like how does HPV actually get like transferred to a person? Like how do I actually get HPV?
HPV is transferred, it's skin-to-skin contact. So it's a sexually transmitted disease, but unlike other sexually transmitted diseases, it's not necessarily passed in the body fluids, it's skin-to-skin contact. So you don't actually even necessarily have to have intercourse to get HPV. It can just be transmitted with close skin-to-skin contact.
Okay. So it's different than say, like we had talked about, something we've talked about before in the past is hepatitis C. Mm-hmm. So obviously we talked about how that's transferred in the blood.
Yes.
So this is not present in my blood.
No.
If I had HPV.
No.
Okay.
Nope. It's skin-to-skin contact. Yep.
So if I hug someone or if I shake their hand or if I'm like even just... if I high-five someone at like a basketball game or something, like I could possibly like pass on HPV to someone or...
Well, I think the HPV that we're wanting to talk about today, the sexually transmitted HPV, you need to have much closer contact than high-fiving someone or hugging someone. You have to have close, physical, fairly intimate contact with somebody. So usually intercourse or oral or anal sex is usually how HPV is transmitted.
Gotcha. Okay. So not at a huge risk for like others for like the major kind of issues if I'm just like, say if I wanted to high five Ty here, like just like right now. Like I wouldn't necessarily, like that was we have to look at each other. We have to look at each other for contact. It's like I think it's like just look down here.
Elbows, yes.
Elbows are the key. But like so apparently so with this kind of like sexual content, I guess is there any way that like a person can like prevent the spread of that while like saying wanting to perform those acts, or is there any sort of safe like barriers in a way? Like we know about like condoms, for example, but are condoms at all effective in helping to prevent stuff like HPV?
Well, condoms can help prevent HPV, but for HPV, because it's skin-to-skin contact, not all of your skin in that area is covered by a condom, so you can still possibly transmit HPV. So condoms actually for HPV don't work the greatest, but you should still wear a condom to protect from other sexually transmitted diseases. Abstinence would obviously be a good way to prevent HPV, but if you're not being abstinent, then the best way to prevent HPV is to get vaccinated. There's a vaccine for HPV.
How long has this vaccine been around?
The HPV vaccine's been around since about 2006.
Okay.
It's recommended for everyone at age 11 or 12, and then it's also available for catch-up vaccination at ages 13 through 26.
So if I'm outside of those age ranges, like say I was born way long ago, maybe in the early 80s, and was outside of, or let's say 70s. I was born in the 70s, way long ago in ancient times in the 1970s, 60s, 50s. Am I outside of that window? Like, then do I not get HPV get the HPV vaccine?
Yeah, pretty much. It's only licensed by the Food and Drug Administration through the age of 26. And
Okay.
The Advisory Committee on Immunization Practices only recommends its use through age 26.
And why? Why is that?
Well, I think that's what the clinical trials, those were the ages in the clinical trials. And then also because HPV is so common that by the time you're 26, most people probably have already been infected with HPV or exposed.
Okay. So we're trying to, so it seems like with the studies and whatnot and kind of how we vaccinate, we try and catch people maybe right before the start of sexual activity. Is that kind of the idea behind this?
Yeah, just with every other vaccine, you don't wait to get your measles vaccine until there's an outbreak going on or until you're going to travel internationally. You want to get it before you're ever potentially exposed. And so the vaccine's recommended at age 11 or 12 before your child has a chance of being exposed to the virus. Also, studies show that the younger you are, the better immune response you actually have to the vaccine. So it's better to get it at that younger age of 11 and 12. And it's more convenient, too, because kids have to get a couple of other vaccines at that age, the tetanus, diphtheria, and whooping cough vaccine and meningitis vaccine. So while you're in there with your kid getting everything else, you might as well get HPV vaccine.
Is there any sort of I guess any side effects or any sort of issues from taking that vaccine at all? Or is there any sort of like potential risk associated with that vaccine at all?
So over 200 million doses have been distributed worldwide of HPV vaccine, and the vaccine is studied prior to it ever being distributed, and then also even after the fact it's studied. And so far, common side effects, just like with all medication, there are common side effects: sore arm, headache, slight fever. You might see redness and pain at the injection site. Adolescents tend to faint sometimes after vaccination, but it's not necessarily because of the vaccine. It's just they don't like needles and getting vaccinated. No. So we usually recommend that adolescents lie down or sit down when they're being vaccinated.
Do you like needles? Because I mean, I don't know about you guys, but I know needles bother some people.
Yeah.
You know?
So I guess here's the thing: I can watch needles go into other people. I cannot watch needles go into my body. So like drawing blood or anything like that, I have to look the other way. I don't know how you guys are with that, but that's me. Needles other people, that's okay. Needles in me, that's
not cool.
Not want to watch. I mean, I understand, but I don't watch it.
Well, I look at it as it's better to have the 2 shots of HPV that you would need versus later on in life having cancer and having to do radiation or having to have your cervix biopsied, or if you get penile cancer, it might have to be removed if you have penile cancer. So all of those are better than getting a couple of shots. So that's kind of how I look at it.
Do you think that like the how common HPV is because of like the nature of people like not being proactive about things but being more reactive, I guess, in terms of like waiting until a problem is really matured until like waiting to address it? Like, say if I notice like a couple warts, be like, oh, I'm not going to go to the doctor yet, because I know plenty of people, like especially now, like if they're going to like the hospital, they'll wait until the arm's off, to actually go. It's like, oh, it's no problem, I'm just bleeding, but
it's a flesh wound.
It's just a flesh wound, right? It's a couple Band-Aids, some rubbing alcohol should be fine. But do you think that it's kind of an issue of that, where like people are just not prepared to go there because they just don't know enough about it in the first place to need to go there?
Well, I think the issue with HPV is most people don't have symptoms. So you don't even know that you have HPV. It's only certain people will go on to develop warts or cancers or precancers. And so most people don't know they have it. And so they don't know that they're transmitting it to other people. And so I think that's why HPV is so common. And then also, like we talked about, it's skin to skin contact. So it's a lot easier to transmit than other sexually transmitted diseases.
So, with the vaccine, if, say I'm a parent, I get my children vaccinated, how effective is that vaccination? Am I pretty much knocking out their chance? You mentioned it was tied to, and we should dig into this a little bit more just as a sidebar, but you mentioned it was tied to cervical cancer and penile cancer specifically. If I get my kids vaccinated, is that risk zero, or how effective is this vaccine?
Well, the HPV vaccine, it not only prevents cervical and penile cancer, it also prevents vulvar, vaginal, anal cancers, oral pharyngeal cancer, head and neck cancers are also linked to HPV. And so the current HPV vaccine that we have protects against 9 of the strains that cause HPV cancers. 2 that cause genital warts and then 7 that cause cancers. And so the effectiveness of the vaccine varies by cancer. So for cervical cancer, it covers 90% of cervical cancers.
Okay.
The vaccine does. But for head and neck cancers, it's only about 60%. So it varies as far as the protection against cancer. But the vaccine itself against those 9 strains is almost 100% effective.
Oh, wow. Mm-hmm. And so it's kind of like this, so just to clarify for all these different, so it's one vaccine that's doing all of this then. So it's not necessarily just like, because, you might go to the doctors and be like, all right, as many needles as I need, right? Like, or how many vaccines am I going to take? But if for just one to be effective against all these different strains, that's pretty cool to hear about for sure.
Yeah, it's 9 strains of HPV are in the vaccine, and they're the most common strains that we see in the United States. So,
okay.
Yeah.
And I guess for like the parents, because kind of thinking about like children, that like if you're thinking about getting your kids vaccinated, but like you might be of the opinion, well, my kids are not gonna have be sexually active or anything like that. It's like they're teenagers. It's like we have a strict rule in this household. You're not gonna go out on Friday night or anything like that. So like to those parents, they're like, well, I don't need to vaccinate my kid because they're not going to be sexually active. What kind of advice would you give to them, like to justify like you still should probably get a vaccine if that is the right course?
Well, yes, the kids should still get the vaccine, HPV vaccine, at age 11 or 12. And we recommend that kids do hold off on having sex, or that they should be abstinent. But eventually, someday, your kid, even if it is when they get married, is going to have sex. And you don't know, because HPV is so common, that 80% of people will have an HPV infection by the time they're 50. And so that person that your child marries might have HPV. And so why not just get the vaccine now before they're ever exposed, when they have insurance coverage for the vaccine and they're a child and they're in the correct age group, and at age 11 or 12 the vaccine has a better immune response. It's just the perfect time to get them vaccinated.
Okay, and I think kind of like, and this is maybe tackling that similar question in a slightly different way. So something that I've come across with this as well, from a parent's perspective, if you get your kids vaccinated for HPV, is that kind of the go-ahead to be like, go wild, go crazy, you're protected, so whatever? Is that communicate to kids from parents, kind of that perspective?
Experts have done studies on whether or not HPV vaccination leads to promiscuity, and there was no difference in the unvaccinated versus the vaccinated group in this study. And also, I don't think I think the conversation needs to be about preventing cancer. When you're giving this vaccine, you're preventing cancer in your child, and that's what your child needs to know. I don't know that there needs to be a discussion about sexually transmitted diseases unless that's appropriate. And then also, there are still other sexually transmitted diseases out there. So just by giving this vaccine, we don't want people to go around and have unprotected sex. We still want people either practicing abstinence or having protected sex.
Well, I guess for to kind of highlight that difference between like, you know, the focus on, I guess, like sexually transmitted diseases and stuff of that nature, I think for like teenagers, that's like more like on a teenager's mind than say cancer. You know, like I guess like for an older audience, you know, like cancer is more in the forefront of their mind. Like if you're like in your 50s, 60s, you know, you're probably thinking more about cancer than anything. But if you're, I guess, like a teenager, because I remember when I was young and, you know, I was only thinking about like a couple of things, you know, I was thinking about high school and like, you know, of course people are thinking about, oh yeah, sex, you know. And so it's to me, and then like I don't recall, like I remember being like mindful of those things, but like people, I guess like the general thing around like if you go around to school or something, most people were not necessarily being like, oh yeah, you got to make sure you got to get vaccines, or you got to make sure you're not getting an STD. Like it's almost like there's this idea that it's just more of a, like there's such a hyper focus on the activity itself that like we forget about like the risk.
The health risk, like the health outcomes, yeah. And I know, and it might just be a product because I graduated in 2017, but I know at that point I didn't even know HPV was a thing, like at all. So you're right, specifically, and I'm trying to remember back to all like the, you know, sexual education classes I had and everything, and I don't remember HPV being discussed. So is this kind of a newer thing that we've learned about, or?
Well, I think HPV has been around forever, but because we didn't really have a good way of preventing HPV, like through condom use like we did with other STDs, it wasn't talked about as much because there wasn't really a way to prevent it. But now that we have a vaccine to prevent HPV, I think people are talking about it more. I also think because of these cancers, especially head and neck cancers are becoming more common, especially in men. And people are seeing actors in the media that have had head and neck cancers. And so I think it's more common to talk about it now than it used to be.
So you bring about I think an interesting point, maybe with health topics in general, kind of a general point. So you talked about a little bit how when there was no action we could take, there was no discussion about the health topic. From your position at the Department of Health, do you see that kind of follow a lot? Is that the case a lot, where it's like once we develop something that we as humankind can do about a disease process, all of a sudden we become very focused on that topic, whereas before, because we can't do anything about it, we're just kind of like, we'll just kind of not talk about that.
We'll kick it off to the side.
That HPV thing, that's a thing, but
maybe it'll go away.
We can't do anything about that right now, so we'll just kind of, that's there. You know, have you seen that? Like,
yeah, definitely. I mean, I work in the immunization program, so I can only think of the diseases that are vaccine preventable. But even when I think of like rotavirus or meningococcal disease, it wasn't a lot of talk about those diseases. And then when a vaccine became available and we were able to prevent it, then that conversation kind of started. So yeah, I think that kind of happens a lot. Yeah.
Well, I think it's good that, the conversation comes about because we can prevent, and it's not kind of a reactive thing, like excising this cancer once, getting this cancer out of your body once you already have the cancer. It's fun, or it's not fun, but it's a good thing that we can talk about this from the point of we can prevent this from even happening to you, rather than, okay, so if this happens to you, we can, get rid of it.
Yeah, and I do think, like, the media, like, attention to it definitely helps, because, like, I know most of the time either, like, through the media you're hearing something about either, like, breast cancer largely, but, like, neck cancer, like, I didn't even have a clue, like, how major it was, because, like, you hear about, like, the more common types of cancer, and then, but, like, to me, like, neck cancer, I'm like, oh, wow, like, of course, like, now I know, like, that's a thing, but like I just had never heard of like a case like where someone was just like, oh yeah, like this person has neck cancer. And so like it's really interesting to actually hear that like those two are connected, because it's kind of like if you didn't know anything about it before, you're like, oh geez, like you'd be like, so that's how that happens.
Yeah, I think a lot of people associate the HPV vaccine with just preventing cervical cancer, and it does prevent a number of other cancers, and so that's why it's important for both girls and boys to be vaccinated. A lot of people think this is a vaccine just for girls, and our immunization rates are higher in girls than they are in boys, but it's preventing cancers in both groups.
And I think that's a good piece to mention too, because oftentimes I think we hyper-focus when we talk about STDs, when we talk about sexually transmitted infections and that sort of thing, we hyper-focus on intercourse between a male and a female that is vaginal intercourse.
Mm-hmm.
So I think it's a very good point that you bring up, that kind of neck cancers are increasing, throat and neck cancers, anal cancers can be caused by this HPV, because that's a piece that I feel like to this point we don't necessarily get connected for us. Even when we're approached with, like you said, kind of that media attention, it focuses maybe hyper on cervical cancer for one type of intercourse.
Yeah, I think there's definitely like a stigma attached to it too, because I mean, anything, even if like we looked at HPV and we focused on just cancer, I think like just even the stigma from talking about sex in general in the United States is just so, people are so reserved on the topic. They're like, if we don't talk about it, maybe like kids won't have sex or people won't have sex, and then these problems will naturally just dissipate. But like we know that's not necessarily true, so it's just kind of like, what do we actually have to do to actually get people to listen? And then so I think like this positive media attention on it, even though maybe classifying positive might be a little bit too. Like, I think any exposure on a health issue is good exposure if people are asking more questions and thinking about it more, because if it leads to further advances or more people to get a vaccine. But of course, the news of someone having like neck cancer is bad, but I think the coverage on it is good.
Well, and I think people don't realize how common it is. So there's a stigma on HPV, but 50% of women graduating from college right now will have an HPV infection. That's how common it is. And so people just need to realize you might as well basically assume everybody has HPV, and you don't know who's going to go on to develop those cancers. You can't pick somebody out and say you're going to have cancer or you're not. That's why we have to vaccinate everybody against HPV.
Well, and just to reiterate, so there is nothing that necessarily tips me off that my partner would have HPV. So it's not like, oh, you have HPV, so I guess this isn't happening today until we get this taken care of. Like, I could necessarily not know if I had it, or my partner could necessarily not know if they had it.
Unless your partner had genital warts.
Okay.
That you could probably see visually. But otherwise, usually people don't know that they've had HPV until sometimes women, when they go in for their regular pap smears, they'll have an abnormal pap smear and then HPV will be identified. Or there is an HPV test for older women where you could test positive for HPV that way. But most of the time, people don't know that they have HPV, and you won't know if your partner has HPV.
Okay, so as far as testing, so testing for women, that's done kind of with their pap smears that they receive regularly, or kind of that test you mentioned at an older age. Is there anything available for males?
No,
Okay.
Nothing available for males. No, not at this time.
And is there anything available to see if you have HPV present, like in your throat or in your anus?
I know they're working on tests. Specifically, I know for the throat, they're working on a mouthwash that can potentially detect HPV. But nothing's available yet to test for HPV, no.
Okay, so far the only place we can test for it is specifically in women, and specifically, is it just the cervix, or can you test for it in the vulva or vagina?
My understanding is that they test in the cervix. I think if you did have an issue with cancers or something and you had to have biopsies, then you could test other areas of the body. But just for routine testing, it would be identified on pap smear, and then when you have a biopsy or something, yeah.
Okay.
So if we don't have necessarily a reliable way of testing for this, how do we define the scope of the problem? Because if it's something where especially for men in particular, if we don't have a method of identifying it, trying to convince men, generally like in other healthcare problems, it's like, okay, go get tested for this, and a lot of people can bring that into attention. There's a lot more media focus around like getting tested, but in this situation, what should someone do? Like if they don't know, like if or do they just go in and they just kind of like try to hope to like keep an eye on the symptoms of it and just try to keep an eye on that, or should they just be more because I think that might have something to do with possibly why people are kind of like more reserved about not necessarily going out and checking this, because if there's not a reliable test for them, then it's kind of like I guess for within men at least, I guess. So I guess my question is, like, what should men be doing then to kind of be focused on trying to address this issue with HPV in particular? And
it's not that there's not a reliable test, it's just not something that's routinely recommended. So they have done studies in groups of men and tested men to determine what the prevalence of HPV is in those populations. That's how they know how widespread it is. But as far as routinely going into your doctor to be tested, because there's no treatment either for men, there would be nothing to do for that. But I think it goes back to prevention. You need to worry about it before you ever get HPV. And so you need to get the vaccine, so you don't need to necessarily worry about having HPV. But yeah, if you have symptoms of genital warts or any symptoms that could possibly be cancer associated, like any time that you have bleeding or anything like that, you should definitely go to your doctor.
Okay. And say that, I guess, and we've been having this conversation more about, I guess, on the preventative side of things. Say if you already have HPV, or like say you actually do figure out that, you are dealing with like either genital warts or you're having some kind of symptom of HPV, and you have it confirmed with like your physician. What should someone do at that point if they do have HPV?
Well, if you do have HPV, your doctor will direct you as to next steps. You'll probably have to go in for more regular screenings just to make sure that it's not progressing to cancer. Sometimes women can have precancers and may have to have part of their cervix removed to kind of prevent further progression to cancer. And so depending on what area of your body it's in, there would be different treatments for it. And then if you do test positive for HPV but necessarily don't have precancers yet, they're just going to watch you more closely and make you have more regular pap tests.
And if you have HPV, do you necessarily need to, like, I guess, like, because we were talking before about, like, not having to, like, I don't want to, the skin-on-skin contact. If I wear, like, a full bodysuit, like, will that work? Or, like, if it was, like, the Naked Gun, like, that scene, like, would that work? Or do I need to be more mindful of, like, actually, like, physical contact with people if I realize that's a thing at that point? Or should I be less worried about handshakes?
Well, like I said, because almost everybody has HPV, there's not necessarily a recommendation to be more mindful. Obviously, you should practice abstinence if you're not in a monogamous relationship. But if you're in a monogamous relationship, you should still try and use condoms. But yeah, I mean, you don't need to break up with somebody that has HPV or anything like that. You just have to be more careful. But most likely, if you have HPV, your partner probably has HPV also.
So like, say if in a situation where, I guess you're in a monogamous relationship and you got one partner, and then suddenly, like, you don't think that you have HPV, and then, like, we know that, like, for certain, like, if a partner suddenly gets an STD, there's usually grounds of, like, concern of,
that
like,
they cheated or something
of that extent, right? And it's like, for HPV, should people be just as worried about, like, other diseases in that situation as I guess for compared, like, to HPV to say another disease like either like herpes or things of that sort?
Well, HPV can take years to develop, and so it's not necessarily that you got HPV from your current partner. It could have been a past partner. You can get HPV the first time you ever have intercourse. I mean, that's, like we said, how common it is. But if you do have HPV, and you are having regular intercourse, you probably just need to be checked for STDs, just like anybody else that's having intercourse. Regardless if you have HPV or not, you probably just need to be checked for STDs.
Okay, so no need to, like, freak out on, like, if it finds out, like, my partner or something has HPV.
We're done.
We're done.
No.
It's like something happened. Like, no, we're good. It's just like, and chances are you probably have it too.
Yes, or you could have been the one to give it to them. Yes.
Yeah. So it's like, it's like, don't blame me for something you gave me.
Yeah.
So yeah, that makes sense.
And I guess something that always comes up when I think we talk about any infection that can be transmitted via sexual contact, is this something that can be passed on to babies? during the birthing process?
Yeah, so if you're pregnant and you have HPV, generally it's not going to affect your pregnancy. It's not going to cause miscarriage or anything like that. The only concern would be if you have active genital warts. And then if your baby is delivered naturally, it could cause something called recurrent respiratory papillomatosis, which
$10 word.
Yeah, RPP. Wait, RRP. Wait,
RRP.
Yes.
RRP.
The resting reserved patients.
Just another acronym for you.
Yes.
And so that can cause tumors in your baby's airway, which makes it more difficult to breathe. And so it's very low risk, but you'll just want to notify your OBGYN if they don't already know that you do have HPV. And so they may want to consider a C-section or something like that for delivery. Yeah.
So that's something you typically would discuss with your doctor, and
Yes.
then they can help you kind of figure out the best way for you to deliver.
Correct,
to avoid.
exactly.
Okay. Okay.
Cool. So there's actually like some. It's good to see because a lot of times when we approach like certain health topics, a lot of it's covered in like doom and gloom and stuff.
Yeah.
And so it's actually kind of good to see that there's actually like some amount of countermeasures involved or some sort of like it's not like we're presented with a problem and then all of a sudden it's like, well, we're just gonna have to deal with it, right? Instead, it's like there's actually things that we could actually be doing. There's actually responses to the issue. So that's always good to hear, especially if like someone's never heard of HPV. It's like suddenly this thing that pops up and you're like, wait, you mean a lot of people have it? And it's like suddenly like a really kind of like scary thing. You're just thinking like, what if the person I'm about to, like I'm about to date or something has HPV? And it's like really, but I think it's actually good to actually have that understanding. So it's really cool to hear about. It's really cool.
And I think, and maybe this kind of gets at to another issue that we've been dancing around at different times too. So we obviously know, we've discussed that kind of at the other end of this. So at one end we have the vaccine, and this is hopefully given to you prior to when you would come into contact with HPV,
Yes.
so that these strains that can cause cancer would not infect your body. So, looking at the other end, for those certain cases that go on to cancer, we have therapies that can cut out that cancer to help those people who are at that end of it, who have the oropharyngeal cancer, penile cancer, cervical cancer, anal cancer. It just seems like the fact that we have this preventative approach, it seems like common sense that it would kind of be the thing that's done all the time. Do you see certain barriers maybe in the environment that we have, either here in North Dakota or maybe in this country in general, to kind of going full bore on this preventative thing?
Yeah, so I think it's getting better.
Okay.
So in North Dakota, about 3 in 10 girls and 4 in 10 boys have not received the HPV vaccine at age 13 to 17, according to the last National Immunization Survey. And North Dakota is actually doing better than a lot of other states at getting kids vaccinated against HPV. I think some of the things we've talked about today, I think parents feel like their child doesn't need it because they're not having sex or they're not going to have sex until they get married, or they feel like it's giving their child permission to have sex if they give them the HPV vaccine. I think that's one barrier. I think other parents have vaccine safety concerns, not necessarily just with HPV, but maybe with all vaccines. Some people feel like it's just so pharmaceutical companies can make money off of vaccines. And so all those things, if I can address each one, I think we've already kind of talked about that it doesn't give permission for your children to have sex. It's a cancer vaccine, and that's how we need to think of it. You're preventing cancer. As far as safety, like I've talked about, there's been over 200 million doses distributed worldwide. It's been around for more than 10 years now. We haven't seen any serious side effects from the HPV vaccine. And then lastly, as far as making money, if you think about it, a lot of these pharmaceutical companies, they would make way more money having to treat cervical cancer, penile cancer, oropharyngeal cancer through different drugs, radiation, chemotherapy, surgeries. And so really, it's a cost savings to get the vaccine instead of having to treat the condition later on in life. I also think for a while, some healthcare providers weren't really recommending the vaccine the same way they did other vaccines at that age group. the HPV vaccine isn't required for school entry like other vaccines. And so I think it kind of made it seem like less important because it wasn't required for school. And it's not required for school because we're hoping it's not transmitted in the school setting is why it's not required, but it's just as important as other vaccines at that age group.
I guess, so do you see, kind of from a maybe looking at a law or policy standpoint, do you think that change of requiring it for school would increase our vaccination rates for HPV?
I do think that if there was a law requiring it for school in North Dakota, it probably would increase our HPV immunization rates. Rhode Island does have a requirement for HPV vaccination for school, and they definitely have some of the highest rates in the nation. But I think already we've done a really good job of increasing our rates drastically over the last few years. So I think we've instituted other procedures instead of having a law we've been able to increase rates. And so I don't see a law happening in North Dakota. And so we're going to have to do it through other procedures or healthcare providers making a strong recommendation for the vaccine.
So I guess going back to this whole, if you get the immunization done, say if you're age 26, and being age 26 being the latter part of that age group, the likelihood of possibly being already exposed to it is pretty high. So in that situation, say if you're a male and you do have HPV, you don't know, but you do get the vaccine. Is there any sort of complications that can arise from this, or is there any sort of, I guess I don't know if I've heard of any sort of like mixed kind of thing that happens where it's like, there's like something bad happens, or
you get the super HPV.
Yeah. Like because we know that like certain stuff has happened with like I guess resistances. So I guess I'm just curious: has there been any sort of developments from that? If the suggested highest age of immunization was 26, if there was anything from that age group that was kind of different than I guess say the younger kids, because I know the point is kind of to get like the younger kids vaccinated first. But I guess for people like say if like someone's listening to this and like, I need to get this done, and I'm like 25, 24, so I guess just for those group of folks, like should they still like get this out even if they've had like numerous partners or things of that nature?
Yeah, definitely. So I think the main thing is you're not, even though you may have one strain of HPV, you're probably not going to have all 9 strains that are in the vaccine. So if you had one strain of HPV, the vaccine would protect you then from the other 8 strains. So if you were exposed in the future to any of the other strains of HPV, you would be protected. And it's safe in people that already have had HPV. So you can go ahead and get vaccinated if you've already had HPV.
And what is in the HPV vaccine?
Well, it's not a live vaccine. It's an inactivated vaccine that has the 9 most common strains of HPV, 2 that cause genital warts, and the other 7 cause a lot of different cancers that we've talked about previously. And so it's recommended at age 11 to 12 and then catch up at age 13 through 26.
Okay, so basically they take these different, we'll call them families, of the HPV virus. They knock them out so they cannot. So in vaccinating myself, I'm not infecting myself with HPV.
Correct. No, It's not a live vaccine. They take parts of the virus and they're inactivated. So you're not giving yourself. Some vaccines are live, like the measles, mumps, rubella vaccine. So you're giving somebody a weakened virus to kind of create an immune response. It's not a live vaccine.
So it's not like the X-Men or anything like that, right? So it's not anything like too wild.
Okay. Healing factor. Yeah. Or the Captain America super soldier serum.
Yeah.
I mean, that was a government conspiracy, so no.
Got to get that super soldier serum before age 27. Like you got to get it right at 26, if you want to be one of the cool kids, right?
If you want to be Captain Rogers. Yeah. You heard it here first. So there is a segment of the show that we are rolling out, and you are our first guest. So we'll see kind of what you think of this, and I do think I'm going to have our producer help us out with this. We went to the interwebs, and we checked out questions that people are asking online on Yahoo Answers about HPV. So, and this is a legitimate question. I feel that this should be answered. So we're asking you, our HPV expert on this. and it's got a little bit of story with it, so I'll kind of read it out. So I'm pretty sure I got HPV from my ex-girlfriend. I have a few questions, though. I read about it on WebMD, CDC, Mayo Clinic, etc., that HPV clears itself from the body. Now, I'm just wondering, does anybody have any idea how long it's going to stay in my body?
Well, that's a really good question. And that's correct. So like I said, most people won't even know that they have HPV because it does clear itself in most people, and some people never develop symptoms. And so usually it will clear itself. There's a small percent that are going to go on to develop cancers. A recent study actually showed that HPV persists longer in men than it does in women, which is something interesting. I can't remember off the top of my head why, but it can persist for a couple of years. And so usually after a couple of years, it will clear itself.
And does it depend what part of the body it infects as far as how long it takes to clear it?
I think a lot of it depends on your immune system and different factors like that, whether or not it will clear itself. And it also depends on the strain, if it's a high-risk type or a low-risk type.
Okay. Because you were saying earlier that that there's some improved resistance, or there for your immune system if you're younger, in terms of it, or was there a difference in the age groups, say if you're 50 or so, is that I guess in terms of your immune system, is it that you're going to be more likely to get HPV at that age as opposed to say if you were younger? I guess even say if the same exposure was present, someone had contact, but is it more likely for the older person to have it? I mean, considering that they didn't have the vaccine.
Well, I think the thing is when you're younger, your immune system is just better, and that's the case for everybody. And so that's why the vaccine works best at age 11 to 12 versus getting it at an older age. Now, you should still get the vaccine if you're older and within that 11 to 26-year-old age group. But yeah, I mean, I think, again, it's going to depend on the strain, and I don't think they really know why some people go on to develop cancer and some people don't. And so that's why everyone has to be vaccinated, because you can't look at a specific person and say, this type of person's going to go on to develop cancer, but this type of person's not. But yeah, it is, especially for people who have compromised immune systems. They're also recommended to get HPV vaccine, especially people who have HIV through age 26 should definitely get the HPV vaccine.
And let's maybe talk about how that vaccine is delivered. So say I want to get myself vaccinated and I was not 27. Mm-hmm. I'm 28. Man. Oh, my brain. Anyway, say that I was not outside that window. Mm-hmm. What would vaccination look like for me?
So if the vaccine series is started before the age of 15, you only need 2 doses of the HPV vaccine at least 6 months apart. So that's another benefit of getting it at a younger age, because if you start the series at age 15 or older, then you're going to have to get 3 doses over a 6-month period. So an extra shot.
Okay. And obviously, how much, very good question to ask. Though maybe with kids, they're not as worried, but parents may be more worried. Oh. How much is this going to hit me in the pocket?
Oh, yeah.
Yeah, so there's a couple of ways to get vaccinated and have coverage. So the Affordable Care Act mandates that insurance covers the HPV vaccine because it's a vaccine that's recommended by the Advisory Committee on Immunization Practices. So if you have insurance, then it should cover the HPV vaccine. Okay. And if you don't have insurance, there's a program called the Vaccines for Children program. It's a federal entitlement program that provides vaccines at no cost for kids who don't have insurance, are Medicaid eligible, are American Indian or Alaskan Native, or are underinsured, meaning they have insurance but it doesn't cover vaccines. And that's because there are some plans that are still grandfathered from the Affordable Care Act that don't necessarily yet comply with the Affordable Care Act. And so there's a small number of children that would fall under that group. And so those kids can access the vaccine through age 18. And then if you're over 18, depending on where you live, some states will have other programs. Like in North Dakota, we do provide the vaccine to anyone through the age of 26 who doesn't have insurance or is underinsured. And so that will vary by state.
Okay.
It's really cool to see that there's like steps being taken even like beyond like I guess even at the like state level for like individuals to help get some assistance with this. And another great point about like even for those plans like from the Affordable Care Act that got grandfathered in, that they're still lagging behind I guess even now in terms of being able to get that care. So that's really interesting to actually see.
Yeah,
for sure.
Yeah, so there's definitely options out there. Cost should not be a barrier for anyone getting the HPV vaccine. So.
Okay.
So now my kids, so I don't have an excuse of cost anymore. No. I don't have an excuse for, so basically now I guess from all of this discussion though, we pretty much know like if I have a kid, like they need to get this vaccine pretty much.
I think so. If they want to keep the genitals. No.
yeah. You don't want to lose it, like that would be bad. I mean, I can imagine just no.
So yeah, I think kind of yeah.
Yeah, no, it's just bad thoughts about that. But I think it's been very very insightful. But is there anything that I guess for like a takeaway from this discussion on HPV? Is there anything else that you could imagine that like people need to, because we learned today about kind of like more of the, stuff that we should be looking out for, preventative steps, possibly looking at like make sure that you get vaccinated within these age groups. And just make sure that was from 11 to 26, correct?
Yes. Uh-huh.
Okay. And then I guess for that point then, like if you have children or if you have partners or if you're, just to be mindful of like these things and like don't let it, be on the back burner in your mind, like make it a point to like get it done. And do you feel like the vaccine is kind of like a set it and forget it kind of thing then, like where like if you get it once, like then you don't have to worry about it like for the rest of your life, or
the two that you need, or the three depending on your age.
Yeah. Because see, that's important. Because see, even now I was just like, oh yeah, there's two, and then like because like a lot of people like to think of vaccines as like one, like one and done, but it's not one and done. It's not one and done. So.
No, once you're vaccinated against HPV, you're protected against the 9 strains that are in the vaccine. But like we talked about, there's over 100 strains of HPV. And so there are some other strains out there. So you could get HPV, a different strain than what's in the vaccine. But again, these are the most common strains that you're being vaccinated against. So, and then we still want people, if you're going to have intercourse, you need to practice safe sex. And so it's not a free pass. There's still other diseases out there that you definitely need to prevent. And then we still do recommend that women have regular pap tests and go in and see their OBGYN on a regular basis, just to check for other things. And then also you still need to check for HPV.
Well, perfect. And a perfect wrap up. So thank you, Molly, for joining us today.
Thank you a lot.
To talk about HPV. And thank you guys for tuning in. And just want to kind of throw out there, make sure you like our page, subscribe, and comment below. Let us know if you have any other questions that you want us to kind of reach out to Molly to get you the answers for, dealing with HPV specifically. And let us know what you thought. Thanks for tuning in.
And feel free to make sure that those questions are kind of like drawn up like Yahoo questions.
Yes.
Like just make them kind of, you can make them funny. Like it doesn't matter how funny they are, like if they're hilarious, like but they're something that you want to know. Feel free to ask it, and we'll make sure to get it back here to Molly.
Yeah, let us know. So thanks for tuning in.
Thank you guys.